I'm the Chief Program Officer for the Alzheimer's Association, the Houston and Southeast Texas chapter. We cover not only the city of Houston, but 37 counties in Southeast Texas, including Angelina County. So happy to be up here visiting with y'all today. I want you to know I went to school in Huntsville and lived in Huntsville for a number of years. In a previous life, I worked for the prison system, and so I used to spend some time over here. It's been a pleasure to be back today. I got here early and drove around for a little while, and I'm stunned at how much Lufkin has grown. This hospital is beautiful and amazing, and y'all are so lucky to have such a wonderful resource in your community. And let me just say, I'm so excited to be here, not only because I'm very happy to bring to you information about who we are at the Alzheimer's Association and what we do and why we do it. But I also have to tell you, the last time that I was in this area speaking to a group this large, it was in Diboll at the Duncan unit at TDCJ. And may I just say, this is a much nicer setting. The food is better and y'all are much prettier. So it is much nicer for me to be here with you today. Before I get started, though, I would like to have you acknowledge a new board member for the Alzheimer's Association. We're so very happy that this gentleman has joined the board. Many of you may already know him, but he's joining us today. He sticks out like a sore thumb because he's the only guy in the room. Please welcome Jim Denman.
A couple quick things. I am brand new. I've been on the board whopping 2 weeks. Told 3 times when I come up here, they said this is a ladies' power lunch. You don't need to go in there. So, anyway, I'm very happy to be on the board. I'm Jim Denman. I'm the CFO at First Bank and Trust. From what I understand from talking to Richard Elvin, the CEO, is I'm the first board member on this association doesn't reside in the Houston area, and so the Alzheimer's Association is trying to reach out and embrace everyone that's within those 37 counties, and I think I'm their test project. Very excited. I'm probably going to learn as much today as you do, and I think this is an awesome association, and everything so far about it has just been wonderful. So I'm very excited to be here, and honored y'all having me with y'all's women's only.
I hope y'all are okay with the fact that we decided to go low tech and not do the PowerPoint thing. I really don't like doing PowerPoint. I prefer to look at people, talk to people, have a dialogue. So I hope y'all are okay with that. I'm going to try and not throw too many statistics at you because that can kind of just flood you with numbers, especially when I don't have a screen to project them on. But I will occasionally toss out a few numbers just because you need to know what the situation is. All right, we are the Alzheimer's Association, and before I get into anything, I just want to make sure that we have a clear understanding of what Alzheimer's disease is, because there is still a lot of misinformation or a lot of misunderstanding about it. Alzheimer's disease is a degenerative brain disease. It is an illness that will eventually destroy the brain and lead to death. In the meantime, it can cause loss of memory, impairment in judgment, changes in your perception, changes in your ability to find balance and coordination, and can eventually even affect those involuntary, very basic human functions like swallowing, breathing, and the like. So this is not just like we used to think, Aunt Martha, she's just senile. We just let her be. She's senile, or dementia. The term dementia we hear like that's something different from Alzheimer's. It is, and I want to make sure we understand that term dementia because we do use it interchangeably sometimes. But dementia is a symptom of Alzheimer's disease. Like a runny nose is a symptom of a cold, dementia is merely a symptom, and dementia refers to that loss of cognitive abilities, the confusion, the memory loss, and all of that sort of stuff. So we at the Alzheimer's Association don't deal just with Alzheimer's disease. We also have resources and help for other related dementias. Vascular dementia, frontotemporal lobe, Lewy body, all these various illnesses that cause dementia. Alzheimer's just happens to be the most common cause of it. About 70% of the cases of dementia are due to Alzheimer's disease. Okay, enough of the lecture and the definition. Let me tell you about who we are. The Alzheimer's Association, the Houston and Southeast Texas chapter, actually started before the National Alzheimer's Association was begun. So we're very proud of that because we feel like we've got the long-standing roots and the long-standing tradition of service. And we started in 1982, not too long, just a year or two before the national organization was founded. And it was founded by two gentlemen who were caring for their wives. And they didn't have any help, didn't have any resources, they didn't know where to turn. So the two of them kind of found each other and started meeting once a week at a local church in Houston. And from those two gentlemen has sprung an organization that right now covers the 37 counties in Southeast Texas. And the reason that I tell you that is that for me, I remind myself all the time of that, of what the power of a single person, what can be done. And so as we talk today, I hope you'll keep that in mind. And if your community needs something, call us, because the power of you and raising up your voice and partnering with others, we can do a lot to combat this disease in your area. Well, what is the mission of the Alzheimer's Association? It is a mouthful. You know, most mission statements are pretty succinct and brief, and that is what all the conventional wisdom tells you it should be, very catchy and quick. You know, like MD Anderson, it's making cancer history. Or Texas Children's Hospital, heal sick children. Well, apparently the Alzheimer's Association didn't get that memo, because ours is about three phrases long. So I'm going to read it to make sure I get it correct, and then we're going to break it down and talk about each one of the components. All right, the mission statement is to eliminate Alzheimer's disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. That doesn't fit on a little business card very well. But let me break it down and talk about the various aspects, and that will help me kind of frame why it's an important part of our mission, how we address it, and why it's so important. All right, so the first part is that we hope to eliminate Alzheimer's disease through the advancement of research. The reason that this is so important is that Alzheimer's disease is the 6th leading cause of death. It's never talked about, but it's the 6th leading cause of death. And among the 6 leading causes of death, it's the only one for which there is no test to detect it, there is no way to prevent it, there is not any real effective treatment. And it is the only one of those 6 leading causes of death for which the rate of death has increased rather than decreased over the past decade. Look at cancer, heart disease, diabetes, HIV/AIDS, stroke. We're all learning more about how to prevent, how to manage, and how to reduce the numbers of death associated with those other 5 leading causes. But Alzheimer's, we are in our infancy. We don't even know for sure what causes this disease. In a very few number of the cases, it's less than 4%, there is a genetic cause. But what about the other 96% of the people who get this illness? Frankly, we don't know yet. And you hear stuff in the news periodically about eat blueberries, drink coffee, coconut oil, do Sudoku puzzles. Fact of the matter is, all that sounds good. I think we ought to do it. But there is not any conclusive scientific evidence yet that tells us that that will prevent Alzheimer's disease. So you can see research is really the key. And once we know either how to detect it early enough, we could see if the meds that we have might really help people. The problem now is these medications aren't used until the person is pretty far along in their course of their illness, because we don't get detected, we don't get diagnosed early enough. We need to know what causes it. We have theories. We know that in the brain of a person with Alzheimer's disease, there is a greater amount of plaques and tangles, is what they call them. And what it is these tangles are a tau protein. I'm not going to get too much into the biochemistry, y'all. It's not my field. But it is a tau protein that causes the little neurons to get tangled up. And then this other thing is a protein called amyloid that causes things to kind of plaque or clump together. And those two things literally interfere with the neural processes and destroy the brain. But why do some people get that and some not? Or why do some people with those plaques have Alzheimer's and others don't? We still don't know. So we have a long way to go, and it's a hugely important thing. And because of that, I'm very proud to let you know that the Alzheimer's Association National is the second largest funder of Alzheimer's disease research in the entire country, right behind the National Institutes for Health. And so at the Alzheimer's Association, the fundraising we do, various things like that, fully 40% of that is earmarked for support of research, because we know it's the key to our future. We at the local chapter in Houston in Southeast Texas, we're very fortunate because our headquarters in Houston is in the Texas Medical Center. And so we're very close to major research institutions and universities, and we have a great relationship with many researchers, and it allows us to stay on top of the latest developments. We do an annual research symposium for the actual researchers, pull them together so they can have very high-level discussions and compare and work together on their research. We also do community research updates, because all of you need to be aware of any recent new findings or new trends in either the treatment or the detection of Alzheimer's disease. So we do that, and we do that up here as well. You'll see, usually in the summer months, spring to summer, you'll see that we'll put out information about either a research or a caregiver symposium. So be on the lookout for sure. In addition, we, in Houston, as I said, we're in the middle of a bunch of research institutes, which is just amazing. But we are lucky enough in our region to actually have some of the top Alzheimer's researchers in the world. Dr. Rochelle Duty at Baylor. We conduct an annual research update just about her specific research every year. It's coming up in Houston on October 21st this year. But Dr. Duty is a leading researcher on clinical trials, and that has to do with some of the test meds, that are medications that are being used. But we have other researchers that are doing all kinds of work, including even what they call bench science, which is with lab rats and animals. A couple of researchers just got awarded in Houston, and by the way, we routinely have 2 to 4 different researchers in Houston that are awarded research dollars from the Alzheimer's Association every year. And for an example of one of our recent ones is Dr. Inez Moreno-Gonzalez at the University of Texas, Houston. And she's working on a study, and it's looking like smoking leads to an increase in those amyloid proteins in the brain in mice. So, I don't know how she taught the mice to smoke, but she must be a pretty smart lady. But the idea is, if we can then do enough research there, then we might be able to switch and look at humans and see, is smoking an actual cause of Alzheimer's? We're way away from that at this point, but that's one of the areas they are looking at, some behavioral or lifestyle kind of choices. Another thing I'll let you know they're looking at is the relations between high blood pressure and Alzheimer's, between diabetes and Alzheimer's, and between high cholesterol and Alzheimer's. So keep that in mind. One of the other key features of research being done is by Dr. Paul Schultz. And Dr. Schultz just also happens to be with UT, but he's working on imaging, because right now there are different ways they try and diagnose Alzheimer's, but it's largely a rule out. You'll do a neurological testing battery and an exam and kind of look at your symptoms, and then they'll say it's most likely Alzheimer's disease. But they can't know for sure, frankly, right now until autopsy. And nobody's volunteering for that. But one thing that has shown promise is spinal taps. There's some evidence that in cerebrospinal fluid they can see some of these plaques and tangles or the proteins that are present. But again, that's an invasive test. You don't want to subject someone to a spinal tap just for grins. And so what Dr. Schultz is working on is brain scan imaging, because it is looking like we're just beginning to see some signs that there may be some brain imaging changes that happen prior to the onset of symptoms, which would be the perfect thing. If we could figure out a way to scan everybody's brain before they're sick, before they're showing symptoms, and then start treating them with the medications, we might get a lot further than we currently are. So that's just one of the kind of exciting areas of research, along with the smoking mice, that we have going on right now. All right, so that's how the Alzheimer's Association supports a part of our mission that has to do with eliminating the disease through the advancement of research. But we have other parts of our mission. If you recall, the second part was to provide and enhance care and support for all infected. Now, what I do in programs, I'm the Chief Program Officer, so my job is to be over all of the programs for the 37 county region. And so this is what's near and dear to my heart. This is how my department helps us fulfill the mission. Let me tell you about some of the areas that we cover. We have a lot of different services and ways to support families and individuals who've been diagnosed. One of the first things that a family should consider when someone's been diagnosed with Alzheimer's or a different type of dementia, there are a lot of safety issues, safety concerns, home safety, leaving the stove on, or somebody might get aggressive or not recognize you, and if there's a gun in the house, they might not need to, but they might injure you thinking you're an intruder or something. So issues like that. And then wandering, wandering off. You see now all the elder alerts, the silver alerts about missing elderly. I want you to know, with Alzheimer's disease, 6 out of 10 people with Alzheimer's disease will wander. So it's a major issue. One of the services that we provide is called Medic Alert Safe Return, and it's a part of those Medic Alert bracelets. We have a relationship with the Medic Alert company, and it is an identification system, so your loved one could have an ID bracelet saying that they are an Alzheimer's patient. But more importantly, they would be registered with this system, the Medic Alert system, and if they ever did go missing, one call to Medic Alert, they would then activate all the emergency services. They would notify fire and police and everyone about this missing person. So it's a great service for families who have a loved one with dementia. But I want to mention something else to you. It's not just for the loved one with dementia. We had a couple that was participating in one of our programs in Houston. Wayne and Carly, I'll call them. And Wayne was the care partner. Carly had dementia. One day, they were at home, Wayne had a massive heart attack. He was able to call 911 for himself before losing consciousness. The ambulance came, took Wayne away, not realizing that Carly had dementia, and left her alone in the house. Now, luckily, it was a good day. Carly knew she was supposed to go somewhere and had enough about her that day to pick up the phone and call somebody and say, my ride didn't come. She did not even realize that Wayne had been carted off. So remember that. You need, if you're a care partner, you need a Medic Alert bracelet as well, so that if something happens to you, they'll know that you have a loved one that you're caring for. That's one of the types of services that we provide around safety. We also provide a 24-hour helpline. It's answered by a living, breathing human being. None of this robotic voice stuff. It is 24 hours a day, and I encourage you and anyone else that needs information, please use that helpline. I do have resources on the back table. I hope you'll grab a pamphlet or two before you leave. In addition, we offer something called a care consultation. And just briefly, let me tell you that after a family gets a diagnosis of dementia, their heads are swimming. They don't know which way to turn. It's overwhelming because it impacts every part of your life. And so what we do and what we offer is a care consultation. We have the family come in. This usually does not include the person with dementia. These are the care partners and other family members. But we have you come in and we help you plan what needs to be done. Create a plan of action to address medical, social, legal, financial, long-term care planning, and ultimately end of life. And so we strongly encourage families to do that. Otherwise, you'll be planning in the emergency moment. Rather than having it all ready when the time comes, it's so much easier to go, activate that plan, we already know what we need to do, than scurrying around trying to figure out what to do. So that's, I think, a very valuable service that we offer. And then, of course, something else that we offer, I was speaking with Lindsay beforehand, we do provide support groups for caregivers. It's something that is overwhelming, it is exhausting, it is stressful beyond belief, and sometimes you need support from someone who's walking the same path that you're walking. You need to hear helpful hints about how to handle issues that they might have had success with. Or you need sometimes to hear a different perspective. I want to share one of those perspectives with you. I was talking with a woman. Her mother had been ill for a number of years. Her mother was now in a nursing home. Her mom no longer remembered who she was. And that's heartbreaking in and of itself, you know. The person that has always provided you with unconditional love now has no idea who you are. That's tough. And so this lady had been going to visit her mom every day, even though her mother did not know who she was. So her mom knew, some very nice young woman comes to see me every day, but didn't know who she was. Well, one day, this lady walks into the nursing home, and her mother thinks that she's 20 years old again, and it's her wedding day. And this lady, I just loved her perspective. And it's one of the things I love most about my job, is I get to meet people who are so giving and loving and brilliantly smart. This lady turned it around. Rather than being saddened that her mother didn't know who she was, she took the attitude of finding that little bit of light and happiness in the situation. She said, how many people get to spend their mother's wedding day with them? With her, you know? So they sat around and did her hair and her makeup and talked about her dress and her bow, and it was a beautiful experience. But if you don't go to support groups, or you don't sometimes hear other people's perspectives, you can get sucked down into that tunnel of despair. And so that's another reason we really encourage people to seek out support groups. You don't need to become isolated. You need to be with other people who are just like you, and it's empowering and it's life-saving sometimes. We also do a lot of education. That's also in my purview. We believe that along with research, educating and making the public aware is the #1 job that we've got to do, because we hear about all these other illnesses and we still don't hear much about Alzheimer's. We do professional training with doctors, nurses, social workers, other helping professionals, and we can offer CEUs, continuing education units, for that training. We do professional conferences in Houston, in Beaumont, College Station, and we are a major contributor, and we have a very major role in the Mission Possible conference that goes on at SFA every year, usually in February or March. We actually design and implement an Alzheimer's track at that conference, which usually is for mental health professionals and others, but luckily we're getting the word out with those professionals. We also do caregiver education, coming out to a community group, a senior center, a nursing home, just talking about various aspects of the disease, everything from what it is to how to communicate better with your loved one who has dementia, and how to take care of yourself better as a caregiver. Because that's what happens a lot. Your doctor's appointments go to the end of the line, your needs fall to the end of the line, and unfortunately, as a result, it's not unusual for a caregiver to predecease their loved one, just like Wayne died of a heart attack before Carly. The stress and all is too much, so we really encourage people to get educated about how to be good caregivers and good care receivers and taking care of themselves. Early stage programs are another thing that we do in my department, and early stage programs are designed for people in the early stages of Alzheimer's disease. They are to keep them socially engaged, because quite often depression sets in and isolation, and what we find is that staying actively engaged, it does not only improve quality of life, but it does seem to keep the brain stimulated and maintaining a better quality of functioning a while longer. So even more important than the Sudoku puzzles and crossword puzzles, which are a good idea, Socialization is very important. And so we do things like go to the zoo or the museum or things like that. These are groups that are not just for the person with dementia. We want their care partner there too, because the care partner then gets to interact with other caregivers and have a little networking session of their own. We do something called Memory Cafe, which is just like a very casual meetup to play games or have a cup of coffee. And then we have something that is, I think, a very unique program. If you know someone who's been diagnosed with dementia and the person is scared, they know something's wrong. They know once they hear that word, it's a diagnosis of Alzheimer's. They know what's coming, and you can imagine they're scared to death. They don't want to lose independence. They don't want to lose that sense of self. But it's hard to talk to your loved one about that because your loved one's also scared. Well, we have a peer-to-peer phone program, and so it is for people that have just been diagnosed. They can get a phone call from someone in the early stage of the illness, someone who's living with it themselves, and have a very frank conversation, talk about whatever they want to talk about. But I think that's a very important program because once someone gets a diagnosis of Alzheimer's, quite often we talk around them. We don't tell that person anything anymore. We talk to their caregiver. And this is a way that they can have some questions answered and be a part of the conversation themselves. One other thing that I'm very pleased and I want to let you know about has to do with something that's going to impact the Lufkin area, and it's a Dementia Resource Atlas. Very happy to say we got a grant from the University of North Texas to create a resource guide primarily for rural counties. Because in Houston, people can find resources. It's a little harder in the rural areas, and so it's not quite ready for rollout. We're still working on it, but I'm going to be bringing it out. It will address doctors, lawyers, home health, gatherings, and other kinds of elder care services and things that could be of benefit to families dealing with this disease. So be on the lookout for the Dementia Resource Atlas. And the reason that all this is so important is, as I said, we need to provide and enhance care and support for all affected. I want to tell you who those all affected are. There are currently 5 million people in the United States with Alzheimer's disease. In Texas, there are 340,000. Of those folks, they are cared for primarily by loved ones, family members, friends. And just to let you know, right now, each year, 17 billion hours of unpaid care is given to those 5 million folks with Alzheimer's disease. Now, that unpaid care means that people leave their jobs or they reduce their full-time job to a part-time job so they can stay at home. It's a huge, huge price tag as well. And I don't want to be mercenary and talk just about money, but it costs $216 billion a year to care for people with Alzheimer's disease. Now, let me tell you a little bad news, as if that wasn't bad enough. The reason for our third part of our mission, which is reduce the risk of dementia through the promotion of brain health, is because if we don't figure out something about how to prevent this disease, by 2050, which really isn't that far off, what is that, 37 years? We will go from 5 million to 16 million people with Alzheimer's disease, and that price tag's going to go from $216 billion to $1.2 trillion. That would be just the price tag for taking care of folks with Alzheimer's disease. 1.2 trillion is bigger than our entire Medicare budget currently, to put that in perspective. This is an illness that can bankrupt Medicare. But it certainly bankrupts families right now because care is so expensive. So for that reason, along with supporting research about how to learn to prevent or discover how to prevent, we do promote brain health, and that is through telling what we currently know. We currently know that having a healthy body helps have a healthy brain. Having a healthy heart seems to contribute to brain health. And so we do tell folks, eat healthy, avoid diabetes, high blood pressure, and high cholesterol. Exercise. It's the things we're all supposed to do. Get your 30 minutes of moderate exercise 5 or more days a week. And stay engaged and active and alive. have friendships, laugh every day, keep your brain stimulated, learn something new, gossip. You know, it's all good. So I'm hearing there's no risk of Alzheimer's among the crowd here today. Okay, good deal. You know, in my family, the gossiping protects us for sure. We go out and do a lot of corporate presentations around healthy brains. We do health fairs just to try and raise awareness. And the other thing that we do is we have a little old fundraiser called the Walk to End Alzheimer's. And just to let you know, our chapter, we actually conduct 13 walks over 8 weekends. We're running and gunning, people, that is for sure. But it is a great fun time. And I say fun, you think, how could this be fun? Well, the cause is deadly serious. But anytime you come together, you feel empowered, and it's joyful, even if it is for a sad occasion. An example, in my family, anytime we have a funeral, it winds up being like a family reunion. We're all drawn together for a deadly serious cause that breaks our heart, but the act of being together is joyful. And that's the same thing that happens at our Walks to End Alzheimer's. Of course, it's important to us because it's our largest fundraiser of the year and raises money to support political advocacy and programs and other functions that we provide to the community. The Lufkin Walk, I'll just let you know, Jim is going to be at the Lufkin Walk, I'm happy to report, and it is on Saturday, September 28th at the middle school. So, if you have interest in joining us, I have some brochures about the walk up there. I also have left on the table brochures about our chapter services and a bookmark. I hope each of you will take a bookmark. It is the 10 signs of Alzheimer's disease. And as you look at those signs, I want you to remember, it's not just because you forget where you leave the keys. All of us do that. It's if you can't retrace your steps and figure out where you were 5 minutes ago, or if your keys wound up being in the freezer, or unusual things like that. So take it as something to look for, but don't do that of thinking you've got it just because of a few things on the list. At this point in time, I would just like to say thank you very much for your attention. Thank you for welcoming me here in your community. And if you ever need anything related to Alzheimer's and dementia, I certainly hope you'll reach out to us. Thank you very much. Yes. Lindsay, is it okay if we just take a couple of questions? Yes, ma'am.
After you're diagnosed,
Yes, ma'am.
what is an average lifespan?
All right, great question. After diagnosis, what is the average lifespan? I have to tell you with the small caveat that it does go differently in every person a little bit. If you're diagnosed with younger onset, there is a fraction of people who develop Alzheimer's disease before the age of 65, in their 50s, 40s, and I've even known of a few cases in the 30s. The younger you are, the more quickly it progresses. Usually it's about a 5-year thing with younger onset. If it is typical after the age of 65, it can be typically 8 to 10 years, but I have also known of people who have lived for almost 20 years. So it is a varying course of illness. Yes, ma'am. Yes, ma'am.
Could it be inherited?
About 4% or slightly less than 4% of the cases are due to a genetic issue. And I will tell you, there's a real interesting study going on in Colombia. There's a family in Colombia where if you get that gene, you're going to get Alzheimer's disease. No doubt about it. And so then they get it at younger onset. And so what we're doing is we've sponsored a study of that family to try and see when, watching them, when can we start detecting this before symptoms. So we might know more too about the genetic aspects once that study's done, but right now it's only about 4% of the cases. Any other?
When do they start giving medication for the disease?
Most doctors would recommend medication as soon as diagnosis. The problem is the diagnosis usually doesn't happen early enough for the meds to really do much to help the person. But most docs recommend getting on the meds as soon as you're diagnosed and staying on them is what most doctors do recommend. Yes, ma'am.
Is this disease in any way being studied kind of concurrently with Lou Gehrig's disease?
Interesting question. Yes, about Lou Gehrig's or ALS. There is a form of this illness that seems to be associated with ALS, and I will just share with you. I know Bill wouldn't mind. Bill Frost was a great friend of our organization. Bill was living with this disease. He was a great advocate. He would go out and do speaking engagements with me. He had been an engineer for Southwestern Bell, just the smartest, most engaging man. And something happened, and toward the end of Bill's illness, he actually was diagnosed with ALS concurrent with his Alzheimer's disease. So we don't have any idea exactly what it is, but yes, ma'am, that's an area of investigation, and something's up there. Yes, ma'am.
What are the first symptoms
Of Alzheimer's? Typically, the first symptoms of Alzheimer's disease, you're going to notice memory deficits. That's almost always the first. And frankly, the person that's having the memory problems is going to recognize it before you ever do, and they're going to be covering for it, most likely. They're going to write notes. They're going to start calling everybody hun, you know, things like that. But quite often, it is that memory, and I'll tell you two people. One is Irene. She was an aunt by marriage in my family. Irene was Catholic, went to church every Wednesday, Friday, Saturday, Sunday, you know, every day of the week. And had been going to the same church for 50 years and was on her way home from church one Sunday and got lost. And that was our indication that something was up with Irene. It eventually got to the point that memory became very, very big problem, and then perception. And one thing I'll share, we laugh about stuff in my family. That's how we cope. So please don't think we were disrespecting Irene. But Irene got to a point where she didn't recognize herself in the mirror anymore. And she'd walk by, and then she'd get so mad, she'd say, "Fowler's got another woman in this house." And we'd have to tell her, "Irene, you know, we'd get two younger ones instead of one 80-year-old. But it does also eventually can affect perception and things like that as well. But memory, that's always the first. Sometimes if the person's real good at covering up their memory, the first sign a family will notice will have to do with judgment, and it'll usually be with money problems or the bills not getting paid and that kind of thing. Yes, ma'am.
We got there yet. I'm on my way. We are.
Well, the question is about imaging of the brain and MRI and Alzheimer's disease. Absolutely, they can do an MRI and certainly show once the disease is progressing a little bit, your brain will literally be shrinking in spots or there'll be holes, so that would be evident. But in terms of early diagnosis, that is not going to help. But that's what they're working on right now in terms of one area of research for early detection is imaging, and there is some hope in that area. I think, how are we doing? One or two more questions? Okay, just come in the black. Yes, ma'am.
Yes, I heard on TV they were talking about copper.
Yes, just recently. This is a very recent study that just came out, and again, I have to caution saying it's just one study. We got to get more that will validate that study before we can make any conclusions. But it was a study showing, and again, I believe it was mice, that an accumulation of copper in the brains of these mice as they aged tended to be linked to the development of dementia-related symptoms. So that is another area they're looking at. But they've also looked in the past at aluminum, and they, you know, for a while they said don't drink out of aluminum cans, or, you know. So I don't know if this will ultimately hold water or if it will be debunked at some point. But that is one of the other things they're looking at.
Something that just hit me, you were saying as to how much Alzheimer's is progressing. Like
Yes.
progressing through the population.
Yes, ma'am.
More than, say, cancer, heart disease, diabetes, and these things, which are quite prevalent.
Yes.
But yet this is going up.
Great question. The reason we're expecting even more numbers is because we're all living longer. And that, everybody, is your number one risk for the development of Alzheimer's disease is age. Yep. Congratulations. But no, honestly, that is what we're seeing, is that simply by the time you hit 85, you've got a 50-50 chance of having Alzheimer's. And so as people live longer, we're going to have more people with the disease.
Almost 90.
Well, one of the, and you are right, one of the things they're looking at is it nutritional related issues? Is it environmental factors with, different chemicals, pollutants, whatever? All of that's being looked at, but the number one issue right now is just old age and living long enough to get this. So it is, and we are expecting all of us to continue living longer. I want you to know, I'm a baby boomer, and we're expecting what we call the gray tsunami, because there's so many baby boomers, and we are aging, we're getting older, and that's what is really fueling a lot of what we expect this huge number, is my generation and the fact that hopefully we'll live to a ripe old age. Yes, ma'am. Okay. Question about distinguishing between dementia and Alzheimer's disease. Dementia is a symptom of Alzheimer's. So if you are having dementia, you need to get to the doctor. It might not be due to Alzheimer's disease. It could be due to something else like a mini stroke. Or, here's a little bit of good news. I haven't laid much good news on you, so tune into this. In older folks, urinary tract infections often cause dementia symptoms. You go to the doctor, you get your urinary tract infection resolved, the dementia symptoms can go away. So please, if you or anyone you know or love ever shows any signs of forgetting and significant memory issues or dementia, get to the doctor, because a diagnosis might be a good one for you. Might be a good one. So we encourage you to get to the doctor. Well, I have time for one more question.
What are the statistics for like head injuries? When they get a head injury?
Thank you for bringing this up. Yes, ma'am. This is also another area of study, is linking head injury that was serious enough to result in a loss of consciousness. That increases one's risk for the development of Alzheimer's disease. I just want to let you know, Bill Frost that I mentioned, Bill was a football player. And you're seeing a lot of research being done now on traumatic brain injuries and all, how it's affected football players, and that football player brains upon autopsy quite often are similar in appearance to Alzheimer brains. And so that is yet another area of interest, but it is recommended. Wear helmets, protect your brain, prevent concussion and other head injuries as one more thing to promote brain health. I'll be